Hello, everybody, and thank you for joining us for this vodcast, which is about partnering with communities to improve health outcomes. My name is Steve Appleton. I'm the European lead for the International Initiative for Mental Health Leadership. I'm joined by two colleagues from the United Kingdom, Andrew Heaven and Peter Bryant. Would you like to introduce yourselves, guys?
Yep, my name is Andrew Heaven, and I'm currently Head of Policy working for the States of Jersey. And at the time of the work, I was the Director of Commissioning for Mental Health and Children.
Hi, I'm Peter Bryant. I'm one of the directors of Shared Future. We're a community interest company based in the northwest of England, and we work with policymakers and citizens to try to make sure that citizens can meaningfully input into policy-making processes.
Well, thank you both for joining me today, and we're delighted to be able to make this presentation about some work that we undertook together, in fact, about 4 or 5 years ago in relation to the development of a new mental health strategy in Jersey. And one of the defining elements of that work was about community and citizen engagement. And we want to share with you that experience, particularly focusing on the benefits that partnering with communities can bring in setting health strategy, particularly with a focus around mental health. So I'm going to ask Andrew to say a little bit about the states of Jersey, the island of Jersey, in the Channel Islands. Andy, can you tell us a little bit about Jersey?
Okay, thanks, Steve. So Jersey, just geographically, is 14 miles long and 9 miles wide, and sits just off the northwest coast of France. In terms of its relationship with the United Kingdom, it's a crown dependency. So the monarch is the Queen is our monarch. However, a distinguishing part of Jersey is that it has its own government. It has its own legislative making powers. So in that sense is quite a unique island, and has a freedom, if you will, to pursue very different and very bespoke policy and laws in relation to its population. In terms of the number of people who live there, as it says on the slide, it's actually just over 100,000 people now, around 113,000, of which a paediatric population of about 20,000. And in the summer, the population goes up by almost a third, very reliant on tourist industry, and also the finance industry also plays a big part in the island's economy. So it has, in terms of the health infrastructure, what would be described as a district general hospital, and it has a number of community services. And within that context, mental health, it has both inpatient and outpatient facilities, with an emphasis on community services. The majority of our workforce, although we have capacity to train nurses on island, we have a partnership relationship with universities in England, so that placements in the UK can be undertaken by student nurses. But the majority of our healthcare workforce is trained and off island, coming back to Jersey to play their part. So that's a background, if you like, for Jersey.
Thanks, Andrew. I mean, I think what you're describing is, in a sense, the unique nature of the island in many ways, yep, but ways in which also it has clear relationships with colleagues in the UK, and in relation to mental health in particular, some special challenges in terms of how you provide for and support people with mental illnesses in a island community, which are very different to those that you would find on the mainland. And I guess in a sense that's where you were coming from in relation to the development of the mental health strategy. I wondered if you could give us a little bit of the background to how that came about.
Yeah, absolutely. Just to pick up on your point, I think that there are some, working on an island, there are some unique kind of diseconomies of scale especially when you get to kind of some of the specialist areas and end of mental health. So some of the tertiary services, quite often we would look for placements off island, and obviously in any other jurisdiction you wouldn't necessarily build or have to have a district hospital for this smaller population. So there's some really interesting dynamics within that, and services for mental health share some of that diseconomy and underlying dilemma. So the background for the work around mental health was that previously there had been no mental health strategy for the island. There had been quite specific plans for different mental health services, which were largely internal and internal facing. There had been some community interest from annual campaigns, typically World Mental Health Day, and that had formed a basis for some charities in particular to group around, but largely on an annual basis. And the gap that was commonly acknowledged was that there was no overarching narrative around mental health. There was which made it difficult for policymakers to identify where the priorities were. It made it difficult for practitioners in terms of service development, service improvement. It made it difficult for ministers in relation to understanding where the gaps were, what some of the political imperatives were around the mental health agenda. And most importantly, it felt quite fragmented in terms of people trying to access and trying to use services, and also just being able to talk about mental health in general. So coming to this, it was very much yes, it was about a strategy, but it was also about facilitating a common discourse around mental health. And the emphasis was very much around public mental health. I was determined in terms of setting the process of strategy making to incorporate the wider commentary and the wider experiences of citizens in relation to mental health as defined in its broadest sense. So lived experience of everyday mental health, as well as the experience of using services in relation to mental health. And that was very much front and center of the thinking. And as part of that methodology was developed, as part of that those set of principles, methodologies were used in the strategy process, which included a citizens panel, which included action learning sets, as well as in-depth a literature review. And all of that work had an oversight and a governance body which helped shape the strategy in the way that it was eventually published, but also in the way that work was led as we moved into the implementation phase. So very much the citizens panel was front and center to a key part of the development of the strategy.
Great, thanks, Andrew. Let's move on then. Pete, you were fundamental to putting together the citizens panel and to running that. Could you briefly talk to us a little bit about what the citizens panel process looked like?
Yes, sure. So to echo what Andrew was saying, really, I guess the days of people sat in the town hall writing strategies and not talking to anybody that is going to be affected by a strategy, those days, I'd love to say have gone, but are certainly on their way out. And lots of people have grappled with how best can we organize a process that makes sure that citizens, and in this example, people with lived experience, are at the center of the design of a strategy. And so some people have been looking at this field of what some people call deliberative democracy. So we have representative democracy where we elect our politicians, but we also should be looking at forms of deliberative democracy where people outside of the election cycle are able to influence what policies are written and how they're written. And deliberative democracy has quite a few different tools that people use in a process like this. So we use the citizens panel, other people talk about mini public, citizens juries, citizens assemblies, but most of them revolve around the idea that you try to randomly recruit a number of citizens, and you take them through a process where they spend lots and lots of time sharing with each other their ideas, their opinions. There are outside experts, if you like, who present further ideas and opinions to the citizens, and then eventually a set of recommendations are written. So we sent out 1,000 letters randomly across the island to addresses across the island, and also did some outreach work to make sure that we reached a wide variety, a good diversity of people. So we went to a couple of centres, community centres, and where we knew that we'd be able to reach some people that we were worried that we wouldn't be able to reach just through sending out letters. So we had a profile, so we made sure that we'd have people with lived experience. We'd have those that didn't describe themselves as having lived experience. We'd have variety of age, backgrounds, genders, and geography across the island. And as is the norm, and I think it's absolutely essential with these processes, we offered an incentive. So participants were paid £20 voucher for every session that they attended. And there was also money there available if people needed to have childcare covered, or assistance with travel, or any kind of support. So the sessions happened over a series of evenings, and you can see some pictures there. Very informal, very relaxed. Lots of small group work in pairs, lots of large group work as well. And lots of challenging. So sometimes things get quite fraught, and sometimes there's consensus, sometimes there isn't. But eventually people come up with a set of recommendations. In this case, we asked them to identify what should be the building blocks for a future mental health system, drawing on their own experiences, the experiences of others within the group, but also at these perspectives from what we call commentators, who are like expert witnesses in a jury.
Thanks, Pete. That's really helpful. And I think that one of the things I would stress, and Andrew mentioned it, Pete alluded to it too, was the fact that the development of this strategy was really built around this desire to engage with the citizens living in the communities across the island. And perhaps the two of you could have some brief reflections on the outcome of that work and the benefits that it brought to the development of the strategy from your perspective.
Do you want me to go first?
Yeah, please do, Andrew.
Yeah, I think from a policy making perspective, I think it gave a real depth and a credibility to the content and to the kind of key building blocks, if you like, that were enshrined in the strategy. I think there was a very clear and transparent decision-making process as part of that, which from a policy context, of course, in Jersey, the minister owns the policy, and that minister was able to see how the different components of the policy were being built up in front of them. So that was quite important. I would also, so transparency was important. In terms of the content, when I designed the methodology, I thought of it in the first instance as kind of separate parts all coming together at the end, but quite quickly it became, we were beginning to use the different components as a parallel, almost like parallel planning. So we had citizens panel running and citizen panel members reporting into action learning sets, and vice versa. So I remember at the time that was particularly powerful, and if I got to do it again, I would revisit that and try and strengthen that in terms of and give it more time, because I think it felt a very powerful and a very important stage in terms of uncovering what were some of the underlying underlying issues that would need to be grappled with going forward. And then finally, the concept of recovery. As anyone who's read this strategy will see that recovery kind of emerges as an activity, as a concept, as a linking and integrating concept. And I think that it represents a slightly different paradigm for many traditional stakeholders, and almost a bridge into that kind of lived experience. So I think, and I know that the Recovery College in Jersey that was established as a part of, as a result of this strategy, is alive and well and continues to develop. And I don't think that it would have thrived in such a way if it was born via a different route, if you know what I mean. So those would be my three things in the first instance, Steve.
Terrific. Thanks, Andrew. I mean, you've been involved in a number of other citizens panels in other parts of the UK as well, and I know that the experience in Jersey's had an influence on how some other systems have done this work, and you've been involved in some of them indeed, including in London and the West Midlands. But thinking about the sort of solutions to the sort of problems that communities face, perhaps you had some reflections building on this final slide around the real benefits of facilitating and encouraging citizen engagement in thinking about health development and health outcomes.
Yeah, absolutely. So looking at your list there, Steve, I think first of all, active participation of local residents is essential to improve democratic and service accountability. I mean, I think it's very hard to argue that citizens shouldn't be the centre of strategy design. I mean, why on earth would you think? Why on earth would you? How on earth could you argue that they shouldn't be there? I think one of the key lessons I think I've seen play out over the last few years, over the last 5 years or so of doing these kind of processes, is how absolutely essential it is that you invest lots of time in them. So these aren't focus groups. These are really detailed, in-depth conversations where people are challenging and listening and appreciating and sometimes arguing, and you can't do that over 3 hours. And instead, you want a process where we're framing really broadly so that people can go in all kinds of different directions, and not directions that are restrained by around professional boundaries of what people should be talking about, which with something like mental health and well-being, I think is absolutely essential. We're not just talking about service design, we're talking about who has responsibility in our communities for these really, really important issues. So in terms of social cohesion, huge amounts of social cohesion are built, I think, through processes like this. People come maybe initially really concerned about why they've done this, and maybe some of them have been attracted by the vouchers, and that's fine. But they get there and they start to realize, oh, okay, so this could actually have an impact on my community. And, you know, I'm starting to make friendships, and those things continue. And so one of the things I think I get really excited about is that I've run about 35 of these style processes over the last 15 years. And without doubt, at the end of every single one that I've ever run, the citizens have said, well, we're not going anywhere. We've got lots of knowledge, we've got lots of expertise, we've got passion, we're now functioning as a group, and we'd like to move on and do stuff. And we've seen that around mental health and well-being in the West Midlands. We saw it around well-being in particular in Blackpool, a deprived town on the northwest coast of England, where the group members of the group went on to design and run a service around people just coming together to chat at a bench and then on a bus, and that's become a fully integrated service into what the council delivers now. And we saw it, Andrew, didn't we, in the citizens that took part in the panel in Jersey, who
absolutely. And I think from when I started design, the methodology and thinking about the strategy, I have to hold my hand up, and I hadn't expected that at the end of the citizen panel process. I thought then that would be the bookend. That's it. And I think the fact that my learning from this is that the ongoing contribution that a panel and panel members make, and I know that a number of those panel members are still active within the strategy and within different services in our community, and I think that's and it's being open to that as a policy maker, as a leader of policy in that space. I think it's really important, and on a personal level, that was a real insight for me, and something that I've taken forward in other work. I absolutely echo that, Pete. Yeah.
Perfect. Well, thank you both for joining me today, just to give this very brief overview of the work that took place in Jersey. I think what you've really successfully managed to convey to all those who'll be watching is the importance of that partnership with communities and really engaging with them in an in-depth way, in a kind of parity of esteem that gives their views and experiences equal weight to those of professionals and policymakers. And that work can continue beyond a specific project, and that actually it needs to become the bedrock of the way in which we work. So I hope that colleagues who are watching will have drawn some interesting knowledge and insights from what you've had to say. I'm sure they will. And if anybody watching wants some further information, please do contact us at IIMHL. Part of our work is about sharing knowledge and good practice, and we'll be happy to connect you with colleagues in Jersey and here in the wider UK.